Welcome to the 284th day of the first of 365 days project. Today we are going to discuss about Nipah virus. Nipah virus was first discovered in 1999 following an outbreak of disease in pigs and people in Malaysia and Singapore. The outbreak resulted in nearly 300 human cases and more than 100 deaths and caused a substantial economical impact as more than 1 million pigs were killed to help to control the outbreak. While there have been no other known outbreaks of Nipah virus in Malaysia and Singapore since 1999, outbreaks have been recorded almost annually in some parts of Asia since then, primarily in Bangladesh and India. The virus has been shown to spread from person to person in these outbreaks, raising concerns about the potential of Nipah virus to cause a global pandemic. Nipah virus is a member of the family Paramoxyridae, genus Nipah virus. It is a zoonotic virus, meaning that it initially spreads from animals and people. The animal host reservoir of Nipah virus is the fruit bat genus Pitorpis, also known as flying fox. Given that Nipah virus is genetically related to Hendra virus, another Nipah virus known to be carried by bats and bat species, were quickly singled out of investigation, and flying foxes were substantially identified as the reservoir. Infected fruit bats can spread the disease to people of other animals such as pigs. People can become infected if they have a close contact with the infected animal or its body fluids such as saliva or urine. That initial spread from an animal to a person is known as a spillover event. Once it spreads to person, spread of Nipah virus can also occur. Symptoms of Nipah virus range from mild to severe, with death occurring 40 to 50% of those infected. Documented outbreaks between 1998 and 2018. Nipah virus can spread to people from, first point, direct contact from infected animals such as bats, pigs or their body fluids such as blood, urine or saliva, consuming food products that have been contaminated by body fluids of infected animals, close contact with person infected with Nipah virus or their body fluids including nasal or respiratory droplets, urine or blood. In the first known Nipah virus outbreak, people were probably infected with close contact with infected pigs. The Nipah virus strain identified in the outbreak appeared to have been transmitted initially from bats to pigs, with subsequent spread within the pig populations. Then people who have worked closely infected pigs began falling ill. Now person-to-person transmission was reported in the outbreak. However, person-to-person spread of Nipah virus is regularly reported in Bangladesh and India. This is most commonly seen in the families and caregivers of Nipah virus infected patients and in healthcare settings. Transmission also occurs in exposure to food products that have been contaminated by the infected animals and including the consumption of the raw date, palm, sap of fruit that has been contaminated with saliva or urine with infected bats. Some cases of Nipah virus can also be reported among people who climb trees bats often roost. The infection with Nipah virus can cause mild to severe disease including swelling of the brain called as encephalitis and potentially death. Symptoms typically appear between 4 to 14 days following exposure to the virus. Illness initially presents at 3 to 14 days of fever and headache and often includes signs of respiratory illness such as cough, sore throat, difficulty breathing. A phase of brain swelling encephalitis may follow the symptoms that include drowsiness, disorientation, and mental confusion, which can be rapidly progress to coma within 24 to 48 hours. Symptoms include fever, headache, cough, sore throat, difficulty in breathing, this is called as dyspnea, vomiting. Severe symptoms include disorientation, drowsiness and confusion, seizures, coma, brain swelling or encephalitis. Death may occur in 40 to 75% of the cases. Long-term side effects in survivors of Nipah virus infection have been noted, including persistent convulsions and personality changes. Thank you.